The balancing act, staying safe on diuretics for congestive heart failure and hypertension. Diuretics, often called water pills, are vital medications used to manage two common and serious heart-related conditions, congestive heart failure, CHF, and high blood pressure, hypertension. For those with CHF, these powerful medications help your body get rid of extra fluid and sodium, reducing buildup that can cause symptoms like shortness of breath and swelling. For individuals with hypertension, diuretics help lower blood pressure by decreasing the total volume of fluid in your blood vessels. While incredibly effective, diuretics also present a shared challenge, the risk of electrolyte imbalances. These essential minerals, like potassium, magnesium, calcium, and sodium, are crucial for many bodily functions, including proper nerve and muscle function, maintaining a steady heart rhythm, and balancing fluids. By increasing how much sodium and water your body flushes out, diuretics can unintentionally cause you to lose these critical electrolytes too. Why diuretics are necessary, roles in CHF and hypertension. When you have CHF, your body tries to cope by activating certain natural processes. These involve hormones that tell your body to hold on to fluid and salt. While these processes are meant to help by increasing blood volume and pressure, in heart failure, they overwhelm your already weakened heart, leading to congestion in your lungs and swelling in your legs and other tissues. Diuretics become essential to counteract this fluid retention, reducing overload and its harmful effects on your heart and overall well-being. In hypertension, diuretics work primarily by helping your kidneys remove excess sodium and water from your body. This reduces the total volume of fluid in your blood vessels, which in turn lowers blood pressure. They can also cause blood vessels to relax, further contributing to blood pressure reduction. By reducing fluid volume, diuretics lessen the workload on your heart and arteries. The double-edged sword, electrolyte imbalances. It's crucial to understand that the electrolyte imbalances discussed below apply to anyone taking diuretics, whether for heart failure, hypertension, or other conditions. Different types of diuretics work in various ways and can affect your electrolytes differently. For example, loop diuretics, like furosemide, and thiazide diuretics, like hydrochlorothiazide, are strong, water pills. They can lead to the loss of not just sodium and water, but also indirectly promote the loss of potassium and magnesium by increasing sodium delivery to the distal nephron. This can result in hypokalemia, low potassium. This is a significant concern because it can lead to irregular heartbeats, cardiac arrhythmias, and muscle weakness. It's often seen with loop and thiazide diuretics. Hyperkalemia, high potassium. On the other hand, potassium-sparing diuretics, like spironolactone, eplerenone, and other common heart failure medications, such as ACE inhibitors and angiotensin receptor blockers, ARBs, which help relax blood vessels and reduce your heart's workload, can cause potassium levels to get too high. This also poses a risk of serious heart rhythm problems. Hypomagnesemia, low magnesium. This can contribute to muscle cramps, fatigue, and heart rhythm disturbances. Hyponatremia, low sodium. Paradoxically, even though diuretics aim to reduce total body sodium, they can sometimes cause your blood sodium levels to drop too low due to excessive water loss. Changes in calcium and chloride, loop diuretics can increase how much calcium your body gets rid of. This increased calcium loss can be a concern for long-term bone health, especially in older adults. Thiazides, on the other hand, decrease calcium excretion, which may be beneficial for bone density. Your chloride levels can also be affected. Metabolic changes, relevant for long-term use. Thiazide diuretics, especially with long-term use or higher doses, can sometimes lead to increased blood sugar levels, glucose intolerance, or elevated uric acid levels, which can trigger or worsen gout attacks. Your doctor will monitor these levels. SGLT2 inhibitors, e.g., empagliflozin, Jardiance. These are newer medications that also help remove extra fluid and sodium from your body, primarily through the kidneys. They generally have a favorable electrolyte profile, though mild sodium reduction can occur. Unlike other diuretics, they are not typically associated with significant potassium or magnesium loss, and may even have a neutral or mild potassium-sparing effect. While mild sodium reduction can occur, and is usually mild and resolves on its own for most patients, these electrolyte imbalances can have serious consequences for people with CHF. They can increase the risk of heart problems, hospitalization, and a poorer outlook for your health. You and your caregivers should watch for signs like unexplained muscle weakness, persistent fatigue, new or worsening heart palpitations, sudden changes in mental clarity. These could signal an electrolyte disturbance. It's crucial to tell your healthcare team right away about any new or worsening symptoms for timely diagnosis and treatment. Strategies for maintaining electrolyte balance. Managing CHF with diuretics is a delicate balancing act. The goal is to remove just the right amount of fluid while carefully preventing and correcting any electrolyte issues. This involves several key steps. Individualized diuretic therapy. Your doctor will carefully choose the type and dose of diuretic based on your specific needs, kidney function, and electrolyte profile. They often start with a low dose and increase it slowly, start low, go slow, to minimize side effects. Sometimes, combining different diuretics, like a loop diuretic with a potassium-sparing one, can help balance electrolyte excretion by working on different parts of the kidney. Rigorous electrolyte and kidney function monitoring. Your key to safety. This monitoring is essential for safe and effective diuretic therapy. Your healthcare team will order blood tests to check your electrolyte levels, sodium, potassium, magnesium, calcium, and also your kidney function. Kidney function is measured by tests like serum creatinine and estimated glomerular filtration rate, eGFR, which tell us how well your kidneys are filtering waste from your blood. Initial monitoring. When you first start a diuretic or your dose changes significantly, these tests are usually done within 1 to 3 days to see how your body is responding. Ongoing monitoring. Once your levels are stable, monitoring often changes to weekly for the first few weeks, then monthly for several months, and finally every 3 to 6 months if your treatment is consistent. When to test more often. If you develop new or worsening symptoms, start any new medications, especially those that affect fluid or potassium, like ACE inhibitors, ARBs, or even over-the-counter pain relievers like NSAIDs, such as ibuprofen, or if your kidney function changes, your doctor will likely order more frequent tests. NSAIDs constrict blood flow into the kidneys by inhibiting prostaglandins. This can worsen kidney function, especially when taken together with ACE inhibitors or ARBs, which affect the kidney's ability to regulate blood flow and filtration. This combination, often called the triple whammy, when used with diuretics, can significantly increase the risk of acute kidney injury. These test results are vital because they directly guide your diuretic dose and help keep your electrolyte levels stable. Understanding your lab numbers. When to call your doctor will give you your specific target ranges for your blood tests and tell you exactly what numbers should prompt a call. However, here are some general ranges and thresholds to help you understand your results. Potassium, normal range, 3.5 to 5.0 milliequivalent/L. Section. Call your doctor if your potassium level is below 3.5 milliequivalent/L, too low, called hypokalemia, or above 5.5 milliequivalent/L, too high, called hyperkalemia. Both extremes can be dangerous for your heart. Sodium, normal range, 135 to 145 milliequivalent/L. Section. Call your doctor if your sodium level is below 130 milliequivalent/L, significantly low, called hyponatremia, or above 148 milliequivalent/L, too high, called hypernatremia. though less common in CHF. Low sodium can sometimes mean you have too much fluid, even if you don't feel swollen. O magnesium, normal range, 1.7 to 2.2 mg/dl, approximately 1.4 to 1.8 milliequivalent/L, but be aware that specific ranges can vary slightly between labs. Section Call your doctor if your magnesium level is below 1.5 mg per deciliter, or 1.2 milliequivalent/L. Low magnesium can make your heart rhythm unstable and worsen muscle cramps. O calcium, normal range, 8.5 to 10.2 mg/dl. Section Call your doctor if your calcium level is below 8.0 mg per deciliter or above 10.5 mg per deciliter. While diuretics have less direct impact on calcium, imbalances can affect your bone health and overall well-being. O kidney function, EGFR. Section Your EGFR number tells your doctor how well your kidneys are filtering. There isn't one specific number that should make you call your doctor, as changes are interpreted by your care team in context. However, know that a significant drop in your EGFR from your usual level may mean your kidneys are under more stress, and your medications might need adjustment. Your doctor will discuss any important changes with you. Targeted supplementation. Your doctor might prescribe electrolyte supplements, including potassium, magnesium, and occasionally calcium, to make up for losses caused by diuretics. The way they are given, by mouth or through a vein, depends on how severe the shortage is and if you have symptoms. For calcium, managing your vitamin D levels is also important, as they're connected to how your body uses calcium. Dietary management. Eating foods rich in potassium, e.g., bananas, leafy greens, and magnesium, e.g., nuts, whole grains, can be helpful. It's also crucial to strictly follow your doctor's advice on sodium restrictions, often less than 2,000 milligrams per day. However, diet alone may not always be enough. Always talk to your healthcare provider before making big dietary changes or taking over-the-counter supplements, especially for potassium, due to the risk of high potassium with certain diuretics or other medications. Potassium-sparing diuretics. Medications like spironolactone and eplerenone not only help remove fluid but also conserve potassium. They've been shown to improve survival in CHF patients by blocking certain hormones. While they don't specifically spare magnesium or calcium, they generally have less negative impact on these electrolytes compared to loop diuretics. However, using them requires careful monitoring for high potassium, particularly when combined with ACE inhibitors or ARBs, or if you have kidney problems. Careful hydration management. It's important to drink enough, but not too much, fluid. This helps avoid making low sodium worse and prevents both dehydration and fluid overload. Your doctor will provide individualized fluid intake goals. Managing your fluids. Beyond water pills, while diuretics are powerful for removing extra fluid, managing your overall fluid intake can also be a crucial part of your CHF care. This is often called fluid restriction, and your doctor may recommend it, especially if you have more advanced heart failure. You often experience significant fluid buildup. Your blood sodium levels are low, hyponatremia. It's very important that your doctor gives you a specific daily fluid goal, as it's not for everyone and needs to be tailored to your individual needs. Your doctor may recommend limiting fluid to 1.5 to 2 liters, about 6 to 8 cups, daily in moderate to advanced heart failure, or if you have low sodium levels. Not all patients need fluid restriction. Tips for managing your fluid intake. Section What counts as fluid. Remember that fluids aren't just water. They include anything that melts at room temperature. This can be Section Water, coffee, tea, juice, soda, milk. Section Soups, broths. Section Ice cream, popsicles, gelatin, like Jell-O. Section even some very juicy fruits, like watermelon. Section measure it out. Use a measuring cup to understand how much liquid is in your usual glasses or bottles. You might find it helpful to measure out your total daily fluid allowance into a large pitcher in the morning and only drink from that supply. Section managing thirst. Section sip, don't gulp, your drinks. Section suck on ice chips, remember they count towards your fluid limit. Section chew sugar-free gum or suck on hard candies. Section rinse your mouth with water without swallowing. Section brush your teeth more often. Section avoid very salty foods, as they will make you thirsty. Section smaller cups. Using smaller glasses can trick your mind into feeling like you're drinking more. The impact of kidney problems. Your kidney function is closely tied to electrolyte balance and how well diuretics work. In CHF patients, especially those with existing or developing kidney problems, the kidneys are less efficient at filtering waste products and controlling electrolyte levels. This means reduced diuretic effectiveness. Kidney problems can make diuretics less effective, sometimes requiring higher doses or combinations of diuretics to remove enough fluid. Increased risk of electrolyte imbalances. Because your kidneys are less able to get rid of or hold on to electrolytes, even standard diuretic doses can lead to more noticeable or quickly developing electrolyte issues. For example, if your kidney function is severely limited, potassium-sparing diuretics or ACE inhibitors/ARBs carry a much higher risk of high potassium, as your kidneys can't efficiently remove the excess. Conversely, severe fluid overload with poor kidney function can make low sodium worse. 1. For dose adjustment, diuretic dosages and choices must be carefully adjusted based on how well your kidneys are working, your eGFR, as some diuretics are mainly removed from your body by the kidneys. Ignoring declining kidney function can lead to too much medication building up in your system and increased side effects. Your role in management, what you can do at home. Managing CHF is a team effort, and you are the most important player. By actively monitoring your health at home, you can give valuable information to your healthcare team and help prevent serious problems. Daily weight monitoring, your early warning system and indicator of overdiuresis. It's vital. Your daily weight is the earliest and most important sign of fluid changes in your body. For individuals with heart failure or significant fluid retention, it helps identify fluid buildup. It's equally vital for anyone on diuretics to ensure the medication is working correctly without causing excessive fluid loss. Consistent tracking helps your doctor know if your diuretic dose is optimized. How to do it correctly. 1. Weigh yourself every single morning at the same time. The best time is after you wake up, use the restroom, and before you eat or drink anything. 2. Use the same scale each day, placed on a hard, flat surface, not carpet. 3. Wear similar clothing each time, or no clothing, for an accurate reading. 4. Record your weight immediately. Keep a dedicated logbook, a calendar near your scale, or use a health app on your phone. When to call your doctor for weight changes. You will get to know your dry weight, your ideal weight when fluid is well controlled. Your doctor will give you specific weight limits, but generally, you should call your healthcare provider if you experience. Section weight gain. Section 2 to 3 pounds, about 1 to 1.5 kilograms, in one day. Section 5 pounds, about 2 kilograms, in 1 week. Section even small, sudden increases can signal fluid retention that needs attention. Section weight loss. Section sudden or unexplained weight loss, e.g., losing more than 2 to 3 pounds over a few days, or any significant, unintentional loss beyond your dry weight. This could indicate section overdiuresis. Your diuretics might be too strong, leading to excessive fluid loss, dehydration, or electrolyte imbalances. Section cardiac cachexia. In advanced heart failure, unexplained loss of muscle and fat, not just fluid, can occur, which is a serious sign of disease progression. Section Other underlying medical issues. Section Report any significant, unplanned weight loss immediately, especially if accompanied by dizziness, excessive thirst, or fatigue. Mastering your medications, consistency is key. Use a pill organizer. Daily or weekly pill boxes can make it much easier to remember if you've taken your medications and when to take them. Set reminders. Use alarms on your phone, a medication reminder app, or even sticky notes in visible places as prompts. Create a routine. Try to take your medications at the same time each day, linking it to an existing habit, e.g., with breakfast, before bedtime. Plan for refills. Don't wait until you're out. Check your medication supply regularly and order refills well in advance. Ask questions. If you're ever unsure about a medication, its purpose, how to take it, or potential side effects, ask your pharmacist or doctor. Don't guess. Spotting the signs of fluid overload, congestion, beyond unexpected weight gain, be aware of other signs that your body might be holding too much fluid. Increased swelling, edema, noticeable swelling in your ankles, feet, legs, or even hands and abdomen. If you press on the swollen area and it leaves a temporary dent, it's called pitting edema. Worsening shortness of breath, feeling more breathless than usual, especially with activity, or if you find yourself needing more pillows to sleep comfortably at night because lying flat makes you breathless. Persistent cough, a new or worsening cough, which might produce white or pink, foamy mucus. Tight clothing or shoes, your rings feel tighter, or your shoes become difficult to put on or take off. Feeling bloated or nauseous, fluid buildup in your abdomen can cause discomfort and affect your appetite. Understanding hidden sodium, read food labels. While your doctor will advise on sodium restrictions, it's not just about avoiding the salt shaker. Much of the sodium we consume is hidden in processed foods. Common culprits, canned soups, frozen meals, cured meats, bacon, deli meats, fast food, restaurant meals, condiments, ketchup, soy sauce, salad dressings, and even many baked goods. Action, always read food labels carefully. Look for low sodium, reduced sodium, or no added salt options. Meeting with a registered dietitian can provide personalized guidance on a heart-healthy, low-sodium diet. Your support system, family and caregivers. Managing CHF is often a team effort. Involve a trusted family member or close friend in understanding your condition and treatment plan. They can help you remember medications and appointments. Support you in making healthy, low-sodium food choices. Learn to recognize your symptoms and know when to seek help. Empowering your support system means they can be an extra set of eyes and ears, ensuring you get timely care when needed. The ongoing balancing act. Managing CHF is not a static process, but an ongoing balancing act. It requires close collaboration between you and your healthcare team, regular monitoring, and adjustments to your treatment plan as needed. Your healthcare providers should proactively educate you on the specific electrolyte risks linked to your prescribed diuretics, key symptoms that need immediate medical attention, individualized dietary and fluid management guidelines, the frequency and importance of laboratory monitoring. By understanding the potential for electrolyte imbalances and using proactive strategies to prevent and manage them, your healthcare team can maximize the benefits of diuretic therapy while minimizing its risks. This ultimately improves your quality of life and health outcomes if you're living with CHF. Key takeaways for managing diuretics and electrolytes. Diuretics are vital but can affect electrolytes. These water pills help your heart and manage blood pressure, but they can also change important mineral levels in your blood. Monitor your weight regularly. Daily checks are key for heart failure, watching for both gain and unexplained loss. Get your lab tests done regularly. Know your numbers. Manage your fluid and sodium intake as advised. Know the warning signs of electrolyte imbalance or fluid overload/excessive fluid loss. Work closely with your healthcare team. They are your partners.